Pharmaceutical manufacturing, if you allow, I'm going to be brief, has 3 levels. The first level is what we call primary, secondary, and tertiary. But before those 3, there is research and development to identify the compounds and molecules. And that is a discussion for another day. The assignment was manufacturing. So for this group, we advise them to look critically at which stage of those 3 levels. The first level, you make the active compound, you do formulation to make sure that the drug, once taken, it will work in the body. And then the last one.
Your Excellency, the facility has been constructed in accordance with WHO standards, following ISO 13485, following CGMP. It has been inspected thoroughly by National Drug Authority. In its first phase, we are ready, as of today, to produce HIV rapid test kits. Now, rapid means they can be used anywhere. You don't need to have a lab. Your Excellency, we lose a lot of people to malaria every day. If today a taxi fell down on Masaka Road or Chiboga Road or Guru Road, it would be on the newspapers. It would be everywhere. But no one counts the people who have died because of malaria, the children, the mothers. And one of the challenges is access to quality diagnostics. If you are poorly diagnosed, the doctor is going to give you a different drug. You keep with the disease, and 2-3 days later, if it is malaria, you actually die. Your Excellency, these products are now manufactured here.
Fortunately, for a very long time, Uganda has been dependent on importation of drugs, medical equipment, and laboratory reagents and other supplies from overseas. Your Excellency, it was just about 15 years ago when Quality Chemicals Limited began to manufacture malaria and HIV drugs locally. And it is now manufacturing even more drugs, including for hepatitis B and many others. This is our pride. And Mr. Emmanuel Katongole, we want to say a big thank you to you. We are therefore very excited that we are now expanding the local manufacturing capacity to include laboratory reagents and other diagnostic devices. I congratulate Microhim Group of Companies for leading in the local diagnostic manufacturing space. We want to thank the Scientific Advisory Committee for the Microhim Group of Companies and the international partner investors for accepting to come in and support local manufacturing, including technology transfer. Please appreciate them. Your Excellency, this investment is worthwhile because Uganda is at the heart of 8 East African countries, including Somalia, with a combined population of more than 300 million people. Moreover, we will also have market access to over 1.4 billion people of the African continent through the African Continental Free Trade Area. Excellency, ladies and gentlemen, in order for you to appreciate the importance of local manufacturing of medical devices, let me take you a little back to the peak of COVID-19 pandemic in 2020 and 2021. The movements of people had been restricted, with the exception of cargo trucks from neighboring countries and food products locally. The Ministry of Health was carrying out a survey to establish the extent of the spread of COVID-19 infection in the population, testing and tracking contacts of confirmed COVID-19 cases, and testing truck drivers to limit importation of the virus. Suddenly, we were running out of PCR reagents and supplies, and countries that were manufacturing didn't want to export them before they could satisfy their own needs. It took the intervention of His Excellency the President, talking directly to the heads of the global manufacturing corporations, for the country to get some of the laboratory reagents and supplies. Your Excellency, we are grateful. However, with local manufacturing, we wouldn't have gone through all these challenges because we would be having direct access to the reagents and supplies. Your Excellency, local manufacturing of in vitro diagnostics is also in line with the global trends, where the World Health Organization is working with international partners like PEPFAR and the Global Fund to promote manufacturing of the diagnostics where the needs are in order to ensure sustainability. On the African continent, the African Union is working through the African Centers for Disease Control and Prevention, that is the African CDC, and African governments to accelerate access to diagnostics in the continent by promoting local manufacturing, building capacity of diagnostic centers of excellence, and facilitating harmonization of regulatory processes, among other initiatives. Most importantly for Uganda, local manufacturing is a deliberate plan in Uganda Vision 2040, being promoted to reduce on the import bills and increase trade revenues to accelerate national development and transition to middle income status. For this venture, for example, as you heard from the CEO, government has supported the investor by providing affordable financing through Uganda Development Bank. And the Ministry of Health and its partners will procure the test kits produced from here, particularly for HIV and...
I want to congratulate the Ugandan scientists for really waking up So it's really not good for people who say they are scientists and they are not able to understand and use this scientific knowledge to solve problems. Then it will be easier for you to find partners in the world, because those partners are there. The ones who have gone, who woke up earlier than you, they are there, and you have found them, like the people from the US. I thank them very much for working with you. And the people from China, I thank them so much. Then the third element is our policy, which is to back awakening, really. I wouldn't want to call it industrialization. Just to wake up and live as modern people. So these funds, which were put in UDB, and we shall always put more funds, are really to support that transformation from a superstition-controlled society to a science-led society. So if you approach, we coordinate, and you approach partners, they will work with you because you have one element of business, which is market, and other factors like labor, cheaper labor, even raw materials. The raw materials here could be cheaper. So therefore, I really want to salute you, young people, for waking up. And getting out of the slavery of dependency, because that has been the problem. It is the mentality. Now, finally, on the issue of offtake, that's not a big issue. The Minister of Health has already told you that we shall buy that minimum quantity which you say you need to get people to partner with you. Those are, as I have told you, those people they have got a clear ekibaro. They are asking you, your government has guaranteed you how much offtake per year. That's what they're asking. They are not saying just offtake. They're saying how much. So, if the offtake is sizable, then they say, okay, we can give you our technology.